Good
Well,
morning.
good morning. How are you?
I'm good. How are you?
Great. Thank you.
So today we are going to talk again about Dexa because I was having a conversation with my sister over the weekend and she had her first Dexa,
And she's 60.
which isn't
No, it's not
correct.
ideal. It should be done at 50.
And she had to ask for it
Yeah.
and her doctor never brought it up ever.
It's another example of women's health being ignored in some areas. She's just had a hysterectomy and is on hormone replacement therapy. She's, by definition of being a 50-year-old, no, she's 60, a 50-year-old woman, she's subject to osteoporosis, or particularly osteopenia, and then to more severely osteoporosis. And at 60, we should know what that is because there are things we can do to prevent it.
Right.
And so having a baseline is very important. Now, your sister exercises a lot.
Right. She's very fit and she's always done weight bearing exercises, unlike me.
Right.
So she's very strong.
Absolutely.
But still, we see it with women like that. We still see osteopenia.
And she's at risk now because of surgery that she had. And she needs optimal hormone replacement therapy.
Yeah.
And continue with the exercise and enjoy a healthy, active life. But the Dexa is not used frequently enough, in my opinion. It's minimal X-ray. It's good information. It's not expensive. And it's something that you need to know about because as both men and women get older, they all get osteoporosis eventually, or at least some bone thinning. And if they're very active, they're more at risk for fractures, which can be fatal because...
Yeah, I know. And she's fallen sometimes, running and just, I have too. It's just tripped. And
so I think it's another example of the unfortunate lack of care that our society gives to women, particularly postmenopausal women.
Right, because let's say you're in your 50s, you have your Dexa as you should, right? Yeah. And it's showing like you're moving in the direction of osteopenia. You at that time can make decisions like, oh, I'm going to start doing weighted workouts. I'm going to start wearing a weighted vest. I'm going to start doing things to prevent this from getting worse. So if you don't know, then you don't know and you're not doing those things.
Right. Absolutely. And Dexa, the purpose of having a baseline is because a Dexa shows bone density. And that changes slowly. And so it is really, and it's hard to correct. So you want to know, it's hard to correct once it's severe. And there are lots of medications for that, but they're not without risk also. So what we want is to know the patients that are initially at risk to take the actions that you described.
Yeah.
There's another point I'd like to make, if I may, to going a little bit off.
You may. Let me guess. Is it about bone score?
Absolutely. Yeah. How did you know?
I just
bone score. Now, bone score is a test of the hardness of the bone. It's an FDA-approved test that was developed here at UCSB, and it's extremely accurate and sensitive. So I feel that when people have a questionable Dexa, that I want them to do a bone score as well, because I want to see if that correlates or if it's more sensitive. And we can actually patients can make the changes that you've suggested, and 6 months later, we could do another bone score and see that they're improving. Whereas if we just use a Dexa for that, it may not be as reassuring that we're improving things.
No, I think that's great too. I almost think that the bone score should also be mandatory.
Yeah,
whether or not the Dexa.
Even though we're here in Santa Barbara, it's not used very much across the country, although the Mayo Clinic are using it now. There are good studies come out of Europe, Holland particularly, Netherlands, where it's being used significantly. But most physicians, even in Santa Barbara, have never heard of this test. even though we've talked about it on this podcast,
Yeah.
the
It was
company,
actually one of our most downloaded episodes
great.
was the bone
Good.
score episode, Peter.
Yeah.
Yeah.
Yes.
Yeah. It was a good episode.
Yeah. For anybody who's listening out there, male and female, get a DEXA at 50,
Yep.
particularly if you're active.
Thank you.